Good evening, everyone, and welcome to Door County Medical Center Live. I'm Dr. Jim Heiss, Chief Medical Officer here at Door County Medical Center. We're going to talk tonight about mental health in the era of COVID-19. As you might imagine, and myself included, there are many of us that have kind of had more than enough of COVID-19, and it's caused some associated issues with that. And so what we wanted to do is try and sort of talk this through and talk what things are most important ways to think about this. And I'm joined today by Allie Brettel. Welcome.
Thank you so much for having me, Dr. Heiss.
My pleasure. Allie is a licensed clinical social worker, and she just joined us at Door County Medical Center. She's not new to the field, she's new to us. So we're thrilled to have her here. And we thought it'd be a great opportunity for the community to not only get to know Allie, but also hear some really good sort of tips and ways of coping. Because I think you probably would agree that this is probably one of the most stressful times many of us will have had.
Absolutely.
You know, just baseline going through the day.
Absolutely.
So I guess in thinking about that, we'll do some talking initially, but then if you have questions or anything like that, we'll do our best to get to those as well. So why don't we talk about some tips for coping? I mean, I know there's a certain amount of even grief. You know, we're grieving for what we had and no longer have. The life today is not like what it was last January.
Absolutely.
So what thoughts do you have on that?
Well, first, I just like to always normalize any feeling that you're feeling currently. There's added stress, added anxiety, added confusion, sadness, anger, frightenedness, helplessness, all of that is a completely normal response. That is a completely normal reaction to a very stressful event. And definitely the pandemic is a stressful event for anybody involved, whether you've been diagnosed or tested positive, whether you're a family member, whether you're a healthcare professional working. So I would just like to first normalize that and understand that it's really important to know that everyone experiences those emotions differently, right? So you may be experiencing something that is the same as me, but we might be experiencing it differently. So I always like to tell my patients, and they always say, okay, Allie, we get it. But I always like to say, be kind to yourself and be kind to others. And today I left actually every single one of my patients with, be kind to your mind. And I like to think about that in two different parts, right? So one, like you said, tips or tools, right? So there are definitely tools for both your physical health and your mental health because the two are so connected. So us in the mental health field like to say that a mental illness is very similar to a physical illness. So you need to use those tips, use those resources to build upon your mental health. A friend of mine actually the other day posted on her social media, it was similar to a Maslow's hierarchy of needs, and it had on the bottom, Maslow's hierarchy of needs, meeting specific needs first in order to take care of yourself, basically, layman's terms. But on the bottom it had support, and that is so huge right now. So support, self-care, self-compassion, all of that. So I like to say, first, tip number one, pause, breathe, and notice how you feel. And then, in turn, use a coping skill or reach out for help. I also would like to say that if you have, those of you who are watching, if you have added tips or tools that I don't mention tonight, please feel free to shoot those in the messages or in a comment, because those could also be helpful for somebody experiencing something similar to yourself. So tip number two, create a daily schedule. A lot of us who are working at home or maybe, unfortunately, you've been laid off or so on, you don't really have a schedule anymore, and that can be really challenging. So create a schedule, stick to that schedule, build a daily routine for yourself. All of this will help with what you can control, because a lot of times right now we don't have a lot of it that's in our control. So that can definitely help.
I sometimes wonder too if, sometimes we one of the things that just made me think of it as you were
Yeah.
talking, that this whole, we have a lot of people that right now they are out of control.
Yeah.
Because as you mentioned, being laid off, if they're laid off of their job, the work that they do, like one place that I always think about, and my heart goes out every time I go to Pick and Save and I see the movie theater,
Oh,
the Sturgeon Bay Cinema.
So, yeah.
What if you work there, or if you own that theater, you have no ability to fix this right now. You have no ability to make it better.
Or even a small business downtown.
Any of them, it's
Yeah.
the same thing. But that's the one that I always think of, and
Yeah.
so. And I often wonder if that's, a lot of the stuff too about how I won't wear a mask and I won't do some of these things. A lot of it is that's the one thing I can control.
Yeah.
So I didn't mean to interrupt, but I just thought of that.
That's a really great.
Yeah.
That's a really great point. Is because we have so little control over the pandemic in itself, we have the ability to control very certain things in our lives. One of them wearing a mask. One of them going out in public only when we need to, so on and so forth. So yeah, no, that's a great point.
Yeah.
Thank you for that.
Yeah.
My next tip, I always laugh because I need to remind myself this all the time. Consume news in moderation,
Oh, Lord,
but
yes.
also from trustworthy sources, because we could go into it such a deep dive in Facebook or any other social media, and it will take us down this rabbit hole of we don't even know where the information is coming from anymore that we're
Right.
getting, and it may not be reputable sources. It may give us completely false information, and so use it in moderation. Once you check for the day, turn it off, put it aside, and move on. That's ones that I have to remind myself of often. And then another tip or tool, I would maintain social connection, right? So even in a world where we have to be socially distant, where we have to wear masks, you still have the ability to maintain a social connection. And a text, a phone call, reaching out to a friend. I also might put, I don't know what to call it, but I might want to put a plug that you can do your holidays this year virtual. That's something that a lot of families are leaning towards, just to keep everyone safe, especially since families are coming from all different areas and so on. So please know that it's okay if you'd like to do your holidays virtual this year. It doesn't mean that you have to be socially isolated, because yes, we are isolated in our homes, but we live in an age right now that we have the ability to connect to others outside of our home without even stepping foot outside of our home.
In fact, I had a friend of mine that pointed this out many months ago, but it's so true. It's this concept of we keep using the term social distancing, and I've tried to make it a habit to say physical distancing, because it really is just that. It's a physical distance. You don't have to socially distance. You can be very social with people, as you mentioned, on FaceTime or Zoom meetings, things like that. So I'll just give an example. I was really impressed with my 13-year-old son and some friends of his. For Halloween, they weren't going out trick-or-treating, and so it was actually one of his friends that said, "Hey, we're going to do a Zoom meeting, and we're going to all watch a Halloween movie, a scary movie together." And they did.
Yeah.
I thought that was just amazing. And it's one of those things where it's like, wow, my son actually is thinking about this stuff, and is, so it really was, was a way for them to enjoy Halloween without going out, and they didn't spend time being mired in, oh, woe is us, we're not able to get together and go to haunted houses. No, we can do it a different way.
Totally. One of my good friends, she lives in Arizona, and she's having a baby right now, and there was no way that I would travel to Arizona for the baby shower, but we were able to have the baby shower via Zoom, and I've attended bridal showers like that, and so on. So it's a very useful tool. Granted, like, Zoom can also be very draining in itself.
Absolutely.
So also maybe use that in moderation, but and I also really love this one too. Like, I was talking to my colleague, and she was like, I would definitely bring this up. She said, if you have the opportunity to safely help another individual, do it. Mm-hmm. Not only does that help the individual that you're helping, whether it be like grabbing groceries for an elderly neighbor, or maybe raking the leaves outside for an elderly neighbor. You never know how you could help, but it not only helps the neighbor or helps the person that you're helping, but it also helps you, and it adds to your ability to feel like you were kind to others. Lastly, I also would like to say that you are not in this alone. There's no reason why you need to do or cope by yourself. If you absolutely feel like you need to, please reach out for professional help. And that's like where I will then give some resources, if you're okay with that, Dr.
Sure,
Hayes,
yeah.
that are available to you in the county, for those of you who are watching. So obviously here in the hospital, I am one of 3 therapists in the behavioral health clinic, but one of the therapists also goes up to Fish Creek, and I will actually be going to the Algoma clinic. I will also put in a plug for this as well. We have an amazing program starting here at the hospital. It's called Senior Life Solutions. I think there was a Facebook post about that on the hospital's webpage just a bit ago, of introducing the program, and it hasn't started yet. I think it starts in maybe next week, a couple weeks.
I think so, yeah, next week.
But it's specifically targeting our senior population here in the county, and all of the information is on the hospital's webpage. So please feel free to take a look at that as well. There are numerous. Oh, sorry.
No, I was going to say,
Okay.
I think before we go into all the resources, because
Yeah.
there's many, and by the way, we'll make sure we put these on the
Yeah.
banner or whatever we call this on Facebook after the recording will be available. Linda just made a comment that I think is a really good comment.
Yeah.
And she says, so what if you don't have access to modern technology and you're stuck at home?
Oh, that's a great.
I mean, and that's hard.
Yeah, that is really hard. That is really hard. Thank you for that, Linda, because that you're right. That is so huge. Honestly, I would say if you don't have the ability to for modern technology, I think it would be a great idea to be able to socially distance outside. And granted, like the weather is getting worse, I understand that, but
Yeah.
To gather either outside or socially distant, or physically distant.
Right.
I'm gonna have to use that from now on, Dr. Heiss.
Yeah.
Indoors if you can. Would you have anything to add?
Well, I think, well, first of all, I think most people, even maybe not the modern stuff like FaceTime, things
Yeah.
like that, but pick up the phone.
Yeah, absolutely.
If there's someone that you can call and have a conversation with. And I know, and there's no easy answers, and so I know we're trying to come up with a solution right this minute, but one of the things that I also think is, I think, and on other Facebook Lives that I've done related to COVID is, I don't think people have to be afraid of getting out and going around. I think we talk about physically distancing. So, even though, as you mentioned, Allie, I mean, the weather is not as nice now as it obviously was in the summer and the spring or even the early fall, but getting out, taking a drive if you're able. And I know maybe you aren't able to drive, but even getting out and doing some of those things, I think, and maybe even a walk around the block. I think if you're outside and there's no one, you're not walking with someone you don't know, you don't have to wear a mask to go for a walk outside. Crossing someone's path for a brief moment is not going to get you infected. So I think some of those things, I think what you don't want to do is literally quarantine yourself where you are afraid to leave the house, afraid to go outside, because you really don't need to be afraid. So many people with COVID these days, I hear people saying, stop living in fear. And my comment is, I'm not living in fear at all. I'm living in what I think is practicality.
Yeah.
And I'm not afraid of this. I'm afraid of what it can do to people. But I think if you're smart about it, wear a mask, get out and about, you can do those things.
I also told a patient of mine just the other day, she said, I don't feel comfortable FaceTiming. I said, okay, well, how about writing a letter? And that she came back and she's like, that was such a great idea because I felt relief after that. So, Linda, you can maybe write a letter too.
Yeah, and Rachel just mentioned that same thing. So
there you go.
Brilliant minds think alike.
There you go. Nice job, Rachel.
Yeah. So what other resources do you have?
Yeah, so let's also, like Dr. High said, we will be posting a lot of these because I have some numbers for some crisis lines. The Door County Health and Human Services, they have numerous crisis lines that are available to you. there's a disaster stress hotline, there's a suicide prevention hotline, and then obviously we have the county crisis line that is available to you 24/7 should you need it. This was such an amazing resource, and we just came across this. It was actually brought to us a little while ago, but this printout can also be posted. But there is on doorcountylibrary.org. It'll take you to a web page such as this. I'm not sure if viewers can see this, but it lists hyperlinks to a bunch of different community resources. And it's not only mental health. They also have emergency crisis line information. They have employment information. So if you are one of those unfortunate people who did lose their job, they have employment information. They have food and clothing information, housing, transportation. They have a list of churches here in the area that are providing some services. So it's a really great, quote unquote, one-stop shop for you, that you might be able to find whatever you may be looking for. So I said it's doorcountylibrary.org/community resources that are available. So that is that. And then I would also just say, if you would like to schedule an appointment with one of us here at the hospital, the number for that is 920-746-0510.
What do you think about, I was asked, I do a weekly radio spot with the Lodge.
You do.
And I was asked, I think it was last week or the week before, what do I tell people when they talk about they're just down in the mouth or whatever? And I told her, I said, I'm honored that you think I know the answer to this. But one of the things that it just struck me when I said it is, I guess gratitude. What do you think about gratitude and thinking about what we do have? One of the things that I've said in the past is, you think about other people that have been shut in and things like that, and I sort of have said, hopefully not cavalierly because that isn't my intention, but we're not being carpet bombed, like they were back in World War II, where you're literally in a bunker for weeks at a time. We're not being carpet bombed. We can, go to Walmart and get our groceries and things like that. And so it's those basic things that we might, I hate going to the store, let's say.
Yeah.
At least you can say, I can go to the store.
Correct.
I may not want to, may make me nervous, but I can do that.
Yeah, absolutely. And I've often found myself encouraging my patients to journal every day as a way to, one, express whatever they feel like they can't say out loud on paper, so they at least can get it out, but also to include in that a gratitude list, because it's very easy for us, especially now in the middle of this, with really there seems to be no end in sight, to at least reflect every day and to say, you know what, these small things are what I'm grateful for the day. The fact that I was able to get up with a roof over my head, I was able to put on my clothes, that I was able to buy myself, small things like that we sometimes take for granted. And yes, we can definitely get caught up in the moment of negativity, but just small micro steps towards positivity can make a very big impact on the end. Yeah,
and I like what you said about giving yourself permission to maybe feel not okay.
Yeah, absolutely.
Because I think, I know when this whole thing first started, way back when, especially with sort of the lockdown that we went through last spring, a lot of that, there were times I would go home at night and it was just disquieting, because we've never experienced this before. None of us in our lifetimes, unless you lived through 1918, none of us have experienced this sort of a situation before.
Yeah.
And so I think just giving ourselves the permission to sort of, if I feel like everything is normal, I'm probably deluding myself a little bit.
Well, yeah, absolutely, because what's normal right now? I don't think that there even is a normal right now, but having that self-compassion and the ability to say, it's okay to not be okay, it's just what do you do with that then in order to help yourself through that, right? And I've heard so many people say, Allie, I've never experienced depression before, but is this what it is? Is this am I normal for thinking? Absolutely. Like,
Yeah.
absolutely. We are in the middle of something that we don't know. We don't know when that's going to end. We don't know what one day will bring from the next.
Right.
And so, yeah, absolutely. That's so, I'm really glad that you reaffirmed that, because it's definitely okay to not feel okay.
Now, someone that shares a last name with you is
Yes.
asking a question.
Can I ask who?
Emily.
Oh, hello, Emily.
Any favorite mindfulness techniques during this time?
Oh, she knows that I'm a huge fan of mindfulness. She in herself is going to school to become a very social worker as well.
Wonderful.
I like to say that it had a little bit to do with that, but I don't know. Mindfulness. So one of my biggest, what is mindfulness practice? Mindfulness is your ability to be in tune with how you feel in regard to an external stimulus. That's how I define mindfulness. One of my favorite techniques is a guided imagery meditation, or just a meditation in general. But also, I like to tell my patients to be still and to be silent. Just simply in turn to be in tune with yourself in the moment, and understanding like what you are feeling in regards to external stimuli. That's what I would say.
Yeah, I for many, many years, I mean, I've been a physician for 20 years probably, I'm thinking. And I always, for many, many years, sort of thought, meditation is what you see in these movies where people are like, and there's smoke. And
meditation can be anything.
I know, and I had the opportunity to have exposure to that about 6-7 years ago.
Yeah.
And it is amazing. I mean, and as you said, it can really be what you want, but just the concept of being quiet, sitting in a chair with your feet flat on the floor, hands in your lap, closing your eyes, deep breathing, and just paying attention to your breath. And that's it. And it's amazing what that will do. And in fact, when you get good at it, you can literally get in an elevator and do that in the time it takes you to get from the first floor to the 10th floor, like if you're going to a meeting or something and you're nervous. You can do it. I'm not one of those that can do that, but I've been told that, and I have people that I know that can do that, and it's amazing. So,
I've also heard, it's also been known to help a lot with sleep. Sleep is not something that we actually talked about yet, but I think that's huge to bring up, especially just because doing like a silent, a deep breathing meditation has been actually, a lot of studies have shown that it positively impacts sleep and sleep hygiene. And that is something that is hugely important, especially right now, because sleep is your biggest way that you can rejuvenate yourself. So yeah, absolutely.
Yeah.
What other questions we have?
I'm seeing, here's a cute name, Yo Gabby Gabby, love it. If we notice someone else is having a hard time, how can we help them?
Thanks, Gabby. She's actually the colleague that I was talking about that posted that picture the other day.
Nice.
That's funny. I'm sorry, could you repeat the question? If
Sure.
we can see somebody?
If we notice someone is having a hard time, how can we help them?
Oh, that's a great question. It's like simply like taking them aside and saying, "How are you doing today?" It speaks volumes. And that's something very, very small that you can do that could greatly impact a person's day, because you never know what that person is dealing with in the day, and maybe that you seeing that, you noticing that, you recognizing that they're not okay, could be the step that they might have needed in order to get help.
Okay, very good. And Emily asks again, just personally, what do you think this pandemic will do for the future of mental health?
Oh, that's a great question. So much has come out of this already. So much we've learned about ourselves already in this pandemic, and it's what, 8 months, 7 months. One thing that is beautiful about a beautiful outcome of this is our ability to reach people who may not have the ability to seek mental health services through telehealth, through video conference. And I think that's huge, because there are definitely certain areas in our country that have a vast is vastly lacking mental health services.
Right.
And so I think that is one of the greatest things that has come out of this pandemic is our ability to reach those who don't necessarily have the ability to reach it themselves.
Yeah, and I think in a lot of cases, a lot of ways, doctors, practitioners, I think there was a little bit of reluctance to go toward telemedicine, and there's this whole concept of, well, there seems to be this barrier between us. We're not in the same room, and then it's the usual, as we've all heard the aphorism, necessity is the mother of invention. All of a sudden, we had no choice. When this whole thing started, when everything was locked down, we had no choice, and the adoption of that went through the roof, and people learned pretty quickly. This is pretty slick.
Yeah.
That there are absolutely times when you can connect, and as I have to look back up, and as Linda mentioned earlier, there are some people with lack of technology and lack of internet here in the rural area,
Yeah, of course.
lack of high-speed internet, and I think this also has moved that forward. I think that really is brought that to the fore, the concept that we need to figure out a way to get everybody connected, even in the rural areas.
Well, that's a good point, because even like with the school system, like internet companies were giving low-income families free internet for a certain amount of time, and that was huge too. I would also like to add that we as mental health professionals have had to adapt in a lot of different ways, in the ways that we either speak with our clients, or building different tools, building different resources, being able to adapt in the moment. I think that has been also a huge contributing factor.
Absolutely. Well. Yeah,
and I'm sure that goes for for other hospital staff too.
I think absolutely. And we were fortunate enough in the my clinical job is as a hospitalist, so I take care of patients who are hospitalized, and we were using some of that telemedicine prior to all of this in the context of stroke care and things like that. So. And it really is amazing the connection that you can make with people even over a television screen.
Yeah, it's obviously it's not as good as in person.
Right,
It's
it
not
never
as
will
effective
be,
as in person, but it's something.
Yeah,
it's better than nothing.
Exactly. One of the things that I will say that I just personally, for what it's worth, as far as seeing an end to this, is the 2 vaccines that have been announced by Pfizer and Moderna. It's pretty exciting, and I know. One of the things that a lot of people are concerned about, I think, is that's great. We talk about 90%, 94% effective. That's pretty amazing, because the annual flu vaccination is between 40 and 60% effective. So it gives you an idea of the potential for this. And I think a lot of people are concerned about, should I get the vaccine when it comes out? Has it been through enough studies? Well, the reality is, the 2 that are out there, they're finishing up phase 3 trials right now, which is the usual stepwise approach to this. And so they will be released under emergency use authorization, but that doesn't mean that they're not safe, at least as far as we know at this point. So I know I'll be taking it. So I look at that as a huge positive, because it would appear that if things go to plan, that by spring of next year, we'll be well through this.
Yeah. That's something to be grateful
with an
for
end
today.
at sight. And so there is literally the light at the end of the tunnel, which until a couple of weeks back, we just didn't have that light at all.
Yeah.
So, and that's what I hold on to that like grim death. I really do, because I am sick to death of this when people say, oh, I'm so sick about hearing it about COVID. I always say,
like,
not twice as much as I'm sick of hearing about this.
For sure.
So, all right. I'm just seeing, is there anything else before we wrap it up? Any other resources that we didn't talk about?
Let's see. We talked about. I do want to say, I know I told you guys this before, but I do want to give the crisis line, because this is the county's crisis line that is available to anybody 24/7. You can show up in person, you can call, you can do anything like that. So the number is 920-746-2588. I also want to put in a plug too of just saying that, yes, all of these resources are available to you. They might just look a little different if you've used these resources in the past. So like we talked about telehealth, like there might be more of that. But so, yeah, just recognize that for sure.
Excellent. Well, the one last thing I'm going to do, there's one person that asked a question that's not mental health related, but I'll answer it so that because it's a good question. If someone gets a positive test, must they get retested and not return to work or normal activity until a negative test is gotten? The answer is no. So once you get a positive test, you need to quarantine or isolate rather. You need to isolate for 10 days from the date either of your first symptoms or the date of the test. And then once you're at day 11, then you're good to resume normal activity, assuming that you don't have a fever or ongoing symptoms. We don't advocate and we generally don't do retesting. And the reason is simple. The reason is very often the test will pick up dead virus. We know enough now that this virus has about a 14-day window of infectivity. And so when we say 10 days from the date of the test or date of symptoms, that takes into account the few days prior to that you might have been infectious. So you don't need to get retested. In fact, I've had a few people that call me and say, I need to get retested because my employer requires it. And I always say, well, let's talk to your employer because that really, you could be out of work for a long time. We've had people that have tested positive for the purposes of donating convalescent plasma. They've been positive for 3 months. And you don't need to be out of work for 3 months. Once the 10-day isolation period is done, assuming you don't have a fever, you're good to go. So Linda asked one more time, what was that number again?
Oh, which number, Linda?
Probably the last phone
the
number
crisis.
you gave. Yeah.
Well, I can give you both. So first, the Door County Human Services Crisis Line, or the County Crisis Hotline, is 920-746-2588, and that's available to you 24/7. And then to speak with one of our mental health providers here in the hospital or to schedule an appointment with us, the number is 920-746-0510.
Wonderful. Well, I want to thank everybody so much for the comments. And Allie, thank you so much for taking your time.
Sir. Thank you.
And you keep calling me sir. I feel like you're talking to my father.
Oh my gosh.
That's okay. No, I'm just being silly. But no,
It's a sign of respect.
This gives you, well, thank you.
Yeah.
This gives you any idea what we have 3 wonderful mental health professionals at Door County Medical Center, and this is just a representation of one of them, and so you can see the talent that we have, and it really is it's an amazing resource, and we're really fortunate in an area of our size to have 3 such talented folks. So please, by all means, avail yourself of their services. They'll be more than happy to help out. So once again, thank you so much.
Thank you. I'm very honored to be part of this team. And please know, I just want to leave everyone with this, that you are not alone. And you don't have to do this alone, and you don't have to experience anything alone, that we are here to help, and we are more than willing to help. So thank you very much.
That's the final word. Thank you very much. Good night.
Good night.